How to suction your child's trach using closed suction. Closed suction can also be called inline suction. You will need to routinely suction your child's trach to keep it free of mucus, which is also known as secretions. Not suctioning often enough could lead to trouble breathing, a mucus plug, or lower oxygen levels, also known as DSATs. You should suction your child's trach at least every 12 hours, and anytime your child is having trouble breathing, you see mucus in your child's trach, hear noisy breathing, your child is coughing often, having DSATs, or needing increased oxygen. Gather the following supplies: suction tubing, closed suction catheter, and sterile saline if your child's secretions are thick. Wash your hands with soap and water for at least 15 seconds or use hand sanitizer. Turn on the suction. Connect the closed suction catheter to the suction tubing and unlock the thumb valve. Make sure the valve is unlocked by pressing it in all the way. To prevent an injury, you must only suction to the measured depth. This depth is noted on the tracheostomy information sheet. Put the catheter in the trach, but do not suction while doing this. Once you see the measured mark in the middle of the small, clear window, press the thumb valve down with one hand and pull back the catheter while securing the trach in place with the other hand. Apply suction for no longer than 5 seconds at a time. Suction as many times as needed until you are no longer getting secretions, but make sure to give your child time to take a few breaths between each suction pass. If the secretions are thick, you may use sterile saline. To do this, pull the catheter back completely and make sure the black tip can be seen in the small clear window. Remove the top of the saline bullet and insert the tip into the saline port. Squeeze a few drops of saline into the port, allowing them to go into the trach. Now suction using the same steps as before. Thin, clear, or cloudy secretions are normal. If they are yellow, green, pink, red, or thick enough that you need to use saline often, notify your child's nurse or doctor. When you are done suctioning, you must rinse the suction catheter with saline to keep it from clogging. To do this, pull the catheter back completely and make sure the black tip can be seen in the small clear window. While suctioning, squeeze a few drops of saline into the saline port and watch the secretions rinse through the suction catheter. Disconnect the suction catheter from the suction tubing and lock the thumb valve. If you have any questions, talk to a member of your child's care team.